one mistake that we see many employers make is they fail to adequately treat the Affordable Care Act compliance process as a monthly process. And workforce data is so dynamic, it's constantly in flux. People start, people leave, data is updated in the various technology platforms within the organization. And so it's important to be monitoring the data within your organization on a regular basis, at least monthly. And so if we look at this visual here, we see these four data domains of time and attendance data, health benefits data, HR data, payroll data. On a monthly basis, one thing that many organizations struggle with is, for those that are using external vendors, it's up to them to really unify and transform that data, to manipulate it into a format that, that can then be ingested by their vendor's data platform. And so there's difficulties around that transformation process. It's administratively burdensome, and they invariably actually end up creating data problems, exacerbating any already existing data issues as they try to really wrestle and jam that data together. Once that data has been unified and transformed, it needs to be cleansed. And we will go into a little bit more detail on what exactly that means here shortly. But really, it's this idea of validating the data to ensure that you're identifying properly any inconsistencies that exist between the various platforms, between data fields, to monitor that, and then to bring that cleansed data back into the system, into the data systems within the organization, such that for future months, it's now accurate. Once you've cleansed the data, you're ready to perform the ACA analytic calculations, for example, determining your full-time folks that are pending full-time status. But that cleansing piece is something that is very often skipped by employers. Really not much attention is given to that. So the key, though, is that it is a monthly process. So